Hello, welcome to this podcast. And in this podcast episode, we will be talking about important nutrient intake on chronic kidney disease and also explore how gut health can influence this disease. I'm your host, Jesse Barra, a current public health nutritionist and master's student in dietetics at Cal Poly Pomona. We will begin with discussing about the importance of this topic and then move towards the medical nutrition therapy recommendations for chronic kidney disease. Finally, I will be highlighting the important key findings from at least 3 research articles about the topic. So we begin with talking about why is this topic important. So our kidneys are very important to helping our body in managing our blood pressure and filtering out waste from our bodies. So it is important to take really good care of this organ. However, there are complications that occur where the kidney, which requires the patient to be evaluated, and may lead to a disease known as chronic kidney disease. So this affects at least more than 10% of the adult population. So a team of experts are needed to help the patient if diagnosed with CKD, and this may include all medical staff, including registered dietitians, to manage the nutrition of the patient. So the registered dietitian's role of the management of chronic kidney disease includes looking at a few things, such as weight changes from over the past 6 months, dietary intake, gastrointestinal symptoms, visual assessment of the subcutaneous tissues, and also muscle mass. Edema is also an important thing to evaluate since there are many fluid changes with patients with CKD. So the symptoms related to gastrointestinal symptoms may include the following, such as nausea, vomiting, and diarrhea, which are part of the nutritional assessment of the patient. Chronic kidney disease is described as having slow, gradual loss of kidney function, which are sometimes caused by other diseases or factors, including but not limited to lupus, chronic hypertension, prolonged urinary obstruction, cystinosis, or diabetes. So according to the National Kidney Foundation, there are 5 stages of CKD. So there is a higher prevalence to stages 3 and 4 here in the United States. And according to the National Kidney Foundation, chronic kidney disease causes complications such as high blood pressure, anemia, weak bones, nerve damage, and also poor nutritional health. Chronic kidney disease can also affect any individual at any age. However, individuals with diabetes, having high blood pressure, or having a history of family with kidney failure, being of older age, including identifying as either African American, Hispanic American, Asian, Pacific Islander, and American Indians are also other risk factors to developing of chronic kidney disease. And next we briefly discuss about the medical nutrition therapy side of chronic kidney disease. So chronic kidney disease requires something called medical nutrition therapy to help manage the nutrition component of the disease. So this is relatively useful during the early, progressive, and end stages of CKD. Many patients with CKD also have underlying conditions including hypertension and diabetes mellitus, and so requires for the registered dietitian to also help to nutritionally manage other conditions the patient may have. As with all MNT, we do begin with the nutrition assessment of a disease or condition. CKD will include finding malnutrition in many patients, and it is important to assess this in a comprehensive nutrition assessment. So this can also include dietary assessments, dietary patterns, food intake, intolerance of certain foods, nutrient restrictions, and fear foods in the assessment. Any physical assessment to include the patient's height, weight, and nutrition-focused physical exams and review of biochemical and laboratory data, including from assessments of the food intake such as kcalories, protein and fat, macronutrients, and micronutrients. The nutrition diagnosis is going to be listing the possible reasons and implications of CKD and may include something such as inadequate energy intakes, malnutrition, excessive protein intake, altered GI function, food medication interaction, disordered eating patterns, limited access to food, and many more. The list does go on since CKD is already a complex condition. So the nutrition intervention is best to be individualized to the patient's needs based on the nutrition diagnosis and progression of the disease. The wellness of the patient is important, and each stage of CKD will have their own guidelines for the condition. And the last steps, including the monitoring and evaluation of CKD, and this helps also to measure the outcomes from the clinical and behavioral outcomes, and would also include other measures such as appetite and blood pressure control and the weight of the patient. And as mentioned from the beginning, we will also be evaluating a few articles that I did find interesting related to chronic kidney disease. So there are about 3 research articles. The first one is called Causal Effects of Relative Fat, Protein, and Carbohydrate Intake on Chronic Kidney Disease, which is a Mendelian randomization study. So this study is by Park et al. In 2021 when it was published. So the authors in this randomization study the effects of specific macronutrients on kidney function. So the study included an observational cohort study which evaluated the relative number of calories from each macronutrient, which was divided by the total calorie intake of the diets of the participants in the study. The data did include to interpret the incidence of end-stage kidney disease, and the researchers implemented a genetic instrument for relative fat, protein, and carbohydrate intake. So the researchers found the macronutrient intake to be the following: 35% of fat, 15% of protein, and 50% of carbohydrate at baseline, and found higher protein intake for people with normal kidney function had lower incident risk of end-stage chronic kidney disease. So the researchers concluded reducing the relative fat intake and increasing protein intake may be beneficial for kidney function for those who derive their calories from high-fat, low-protein diets. Our second research article, titled Randomized Trial on the Effects of Dietary Potassium on Blood Pressure and Serum Potassium Levels in Adults with Chronic Kidney Disease by Turban et al., a research article done in 2021. So this second article highlighted the effects of potassium since they have not been well studied in patients with chronic kidney disease. So the researchers conducted this randomized trial to study the effects of its diets containing about 100 millimoles of potassium a day and also about 40 millimoles of potassium a day on blood pressure in adults with stage 3 chronic kidney disease and those with treated or untreated systolic blood pressure. So the study was an investigator-initiated single-center double-mask 2-period crossover feeding trial that was sponsored by the American Heart Association. It included participants ages 18 and older who had history of hyperkalemia, which required insulin or had uncontrolled diabetes. So this used potassium supplements or also had other chronic diseases. So the diet consisting of the 100 millimole of potassium per day was chosen because it approximated the upper limit intake from the Kidney Disease Outcomes Quality Initiative. So the 40 millimole of potassium per day diet achieved a difference of 60 millimole of potassium between diets. The researchers found the higher potassium diet was similar to the DASH diet, which included potassium-rich fruits and vegetables, low-fat dairy products, poultry, whole grains, fish, and nuts, and reduced the amount of red meats, sweets, and sugary beverages. Other nutrient goals includes a diet consisting of 50% from carbohydrates, 37% from fat, and 13% from protein. So the participants were fed for all meals, including breakfast, lunch, and dinner, and included both meals on site and at an off-site location. So in this study, a higher dietary intake of potassium did not lower the blood pressure, and concluded more additional trials are needed to understand the health effects of an increased potassium intake for patients with CKD. Our last article, titled Probiotics-Supplemented Low-Protein Diet for Microbiota Modulation in Patients with Advanced Chronic Kidney Disease, results from a placebo-controlled randomized trial, and the authors by Mauri et al. Research in 2022. This randomized control trial was designed for investigating the low protein diet, a lower protein diet, and a new formulation of probiotics. So there were 2 probiotics that were used in this study, specifically for combining those 2 with the low protein diet. One of them was called Bifidobacterium longum, and the second probiotic, Lactobacillus reuteri. These 2 probiotics were effective in reducing uremic microbiota toxins in patients who had advanced chronic kidney disease. The researchers found after about 2 months of consumption of a low protein diet along with the probiotics, in patients, they found in patients' blood urea nitrogen, total cholesterol, and triglycerides reduced. So patients ages 18 to 80 years of age with chronic kidney disease participated in this study. So a low protein diet was recommended for the patients consisting of about 0.6 grams of protein, less than 6 grams of salt, 800 milligrams per day of phosphorus, less than 10% of monounsaturated fats, and less than 300 milligrams per day of cholesterol, and also a high fiber content in the diet. Supplements such as vitamin B12, folic acid, calcium, vitamin D, and iron were prescribed. The probiotic supplements were provided with a low-protein diet consisting of high plant-based foods and free protein products. So the researchers found with use of probiotics and low-protein diet, it helped improve a few things. One was the quality of life of these participants in the study. And the second was the delayed progression to end-stage renal disease and the need for dialysis. So this study did show promising evidence as well that probiotics are beneficial for patients with CKD. So the researchers did believe this can also help with the adverse effects that CKD has on people, and also on malnutrition. And also, a low protein diet with probiotics will allow for more ecological and plant-friendly management of renal disease, and this can also be used in the new feature. So the researchers believe that these effects can also be these two components of a low protein diet, and also combining that with supplements with probiotics, specifically the Bifidobacterium longum and Lactobacillus reuteri, were both very effective for this study, and this will be very hopeful for them to be able to use those for the new feature. So this study basically concluded those results. And so the first article did talk a little bit more about the effects of the fat, protein, and carbohydrate. Second was mostly for the effects of dietary potassium on blood pressure. And the third one, combining a low protein diet along with a probiotic supplement as well. This does conclude the podcast for today. Thank you for listening, and we hope you enjoy listening about latest research about nutrient intake and where the future of gut health is also going with benefiting our overall health and wellness, and for patients with chronic kidney disease. So please remember the information today should not replace professional medical advice or use for diagnosis purposes.